This Jenny, this is our booth at the first 3D Heals conference in San Francisco back in 2017. A very fond memory of Dean Carson and I at that conference, and Paul came out from Australia to speak. Fantastic experience, and still very much relevant to today. So I started as a medical device rep and had no idea that I would fall in love with the field of all things medical device. And at that time, 3D printing was just kind of being applied to medical devices, both in the total joint replacement world as well as in spine. I remember these pictures represent on the left here two basic implants, and then on the right, these knee jigs were being introduced by a company called Medacta, and at the same time, these spinal implants are being introduced by a company called Forweb. And I remember going around and talking to the spine surgeons, and I said, "Hey, I've got this cool implant." And they said, "Well, we'll never stop using this peak stuff because titanium is too hard and bone won't fuse to it." And I said, "Well, this is kind of different, I think. Maybe give it a shot." No, no, I'm not changing from peak. And I reached out at that time to Paul Durso, who was running Anatomics in Australia, and I said, "I really think this 3D printing thing is going to be a big deal." And I went out and started my own independent distributorship and started adding products to my bag. And he said, "Josh, it's ironic you're reaching out because I think it's a very big deal, and I'm going to be heading to the Bay Area very soon. Why don't we meet up?" And he, comes, we meet up. He puts out all these different implants, and these are things that I still to this day have not seen anybody else do, all custom patient specific stuff. And I also met Dean Carson, who ended up being his VP, and Gibran Maher, who was also part of the sales team. And really, us three were bringing this message to the US market at that time. And I was also running my own agency and started picking up 3D printed products